Butler is Vice President of Domestic and Economic Policy Studies at the Heritage Foundation. Dr. Butler has been with the Foundation since 1979 and worked on an array of policy issues ranging from healthcare to welfare reform. The Heritage Foundation promotes public policies based on the principle of free enterprise, limited government, and individual freedom. Welcome.
Thank you very much indeed, Madam Chairwoman. And I also want to join with Len and Linda in applauding you and the committee for approaching this in a bipartisan way. And I think that's reflected actually outside of the Congress. With Len and I don't always agree on things. So I think there really is a good and spirited discussion which is very, very positive in this. I also agree with you and with Mr. Stuart that we do see in the small business sector structural weaknesses in the ability of small firms to do the kinds of things that large firms can do in the insurance area, and the nature of the workforce, the change in the workforce exacerbates that issue, and the difficulty of having grouping is of course an inherent problem. So there are many inherent problems with small businesses trying to do this, which we all recognize. And so you've asked us how, in this context, should we move forward in trying to provide coverage. I would say that I am skeptical, and I would caution you about the idea of trying to model steps forward for small firms to try to model what happens in the large business sector. And I think that does go to ideas like creating larger groupings of smaller firms to try to operate as though they were large firms in the purchase of insurance. I think that trying to group small firms, either in a co-op or some other type of device, does risk various kinds of perverse incentives in terms of how individual companies will view those co-ops, view their joining or not joining, how risk is spread, and so on. I think trying to group firms together also will not fully deal with the portability problem that we see generally in our society, and is particularly noticeable in the small business sector. And I just want to emphasize also what Len said, that the feature of your legislation that says let's try to provide a subsidy through the tax system, a tax credit directly to firms. The evidence, and we both agree on this, the evidence is that that is an extremely expensive way and a very imprecise way of providing subsidies when they're needed. You could end up with a situation where the cost per newly insured employee under that situation could be more than double what we see in either individual tax credits or even expanding public programs into those areas. So I'd certainly caution you about that. I think a better way forward, a better approach, in my view, is to start down the road of thinking a little differently about the role of the small employer in the future with regard to insurance. And the key to this, I think, is to separate the notion of the employer's role as what I would call a facilitator of insurance, doing the financial transactions in this area, from the role of sponsoring insurance, actually trying to organize insurance. And I would just point out that if you look at the recent history of retirement programs and IRAs and so on, we've kind of gone down that direction in that area of saying employers have a certain role, but they're not there to manage your money in some way. And I think there's a strong lesson there with regard to how we think about health insurance. If you're thinking this way, I would suggest that that approach would suggest maybe a road that has three elements. And I think this does echo what you've heard already. The first element is to say, well, let us set up an infrastructure. It's often called a health insurance exchange, modeled on the FEHBP or the connector in Massachusetts, which actually carries out the function of organizing and sponsoring the coverage itself and offering different plans within that, providing a menu of options, enabling people to have full portability if they change employers within that exchange. The plans within such an exchange could be offered by discrete organizations or groups, such as labor unions, such as consortia of churches, farm bureaus, and so on. So I think there's lots of elements there to bear in mind. And in this situation, the states would function as the primary place in which issues of pooling and risk would take place. It would be within the exchange, not within groups of employers under that model. Again, similar to how we look at it in the FEHBP. The second element would be to explicitly make employers the facilitators rather than the sponsors of coverage. That means that, in effect, what small firms would do in this case is basically specify that the exchange itself and the plans within it would be their plan, and they would not themselves be trying to organize insurance. And much as you as a member of Congress and other members of Congress don't get together as a co-op and try to offer insurance to your employees, you say the plan is the FEHBP, and all those issues are carried out in that area. So the employer's role would be primarily making deductions from payroll deductions, sending premiums, perhaps adding contributions, and so on. Then the third element, which again I think reflects what you've heard, is that to make this more effective, and indeed to make the whole system more effective for our employers, it means that you must address the tax treatment of healthcare. And I share Linda's cautions about the ways of doing that, but I think we see a tax system today which is inherently inequitable, inefficient, really gets in the way of creative solutions for the small business sector or for other sectors. So just in conclusion, I applaud very much what you're attempting to do, and you recognize and are focused on the special concerns of small businesses. I think those concerns do force us to think creatively about better ways to organize and to re-examine the role of employer. And I just want to end by absolutely agreeing with Len that this actually gives us an opportunity to look at creating a structure and infrastructure and a way forward which will not only fix the problem for small employers, but in my view would be the model that over time would extend to the working population in general. So I think one should see the small business sector as potentially the model, the leader in dealing with this problem, rather than thinking of it as a sort of a step-sister that you have to just sort of deal with their particular problems.